everybody. So my name is Kristen Schapler. I'm the Director of Sales and Recruitment for Barton Healthcare Staffing, and we are doing a Q&A today about travel nursing and traveling allied health. So I'll just give a little bit of a background while we're waiting for more people to join on here. I've been in the healthcare staffing world since 2014, so it's about 7 years. I started out on the physician staffing side of things and then came over to nursing and allied health, which has been an exciting change. So we wanted to talk to you guys about both some questions that have been submitted as well as any questions that you guys can think of on the fly here. I'm happy to answer whatever you come up with. So we will dive in. My colleague Chris is going to be submitting some questions through the chat here, and I will answer them as they pop up. But feel free to bring anything up that you can think of. So let's see. Okay, so one big question that we get frequently is, what does BHS need from our clinicians in order to get started? And we actually make that quite simple. What we ask you for is just simply your resume. And we can help you update it as well. So if it's missing your most recent job, that's okay. We ask you for 2 supervisor references, so your most recent supervisors from any recent travel jobs you've done. That's always great. And then just a conversation with a recruiter. So it's pretty straightforward. The recruiter will do an intro conversation with you, get to know you a little bit. They want to understand your background, so they'll go over the resume together with you, your experience level in different specialties, your skill set, your travel preference, your availability, right? Everything that we need to know to get you placed in the right position. Your recruiter will cover that for you along with that resume and those references like I mentioned. So pretty straightforward to get started. All right, let's see what other questions we have here. So can I take time off while we're on an assignment? So absolutely. That's a question that pops up almost every day as well. So good one there. Travelers take time off all the time during their assignments, and people also travel because they want to take time off, right? So part of the advantage of traveling is you can play a role in deciding how long of an assignment you're going to take and then how much time in between assignments that you want to have off, right? So you can take a 3-month contract that ends in September, and then maybe you want to take the month of October off, or take a couple weeks off before you take your next contract. So you're totally in control of that. But then also, if you have time off that you need during your contract, that's totally fine as well. So what we would do is just get those dates from you on the front end, and we would let the facility know about the dates that you need off at the time that we present you. And then once they accept you and we move forward, we would put those dates as approved time off in your contract so that you know you're good to go. So pretty straightforward with time off, and it's almost never a deal breaker for the facilities that we work with. Most of the time they really need the help and they appreciate the help. So a week off or a weekend that you need dates off, not a big deal. So good question there. Let's see what's next. Okay, so can I work with BHS if I also work with another agency? Absolutely. Most travelers that we talk to do not put all their eggs in one basket. So different agencies are going to have different relationships with facilities throughout the country, right? There are many different national staffing agencies when it comes to travel nursing. So most travelers have relationships with, I would say, at least 2 or 3 different agencies, and those 2 or 3 agencies are going to have different contracts available to you at different times, depending on the facilities that they're in touch with. So you're at an advantage if you work with multiple agencies, and there's no reason to hold off on doing that. So good question there. Thank you, Chris. We'll see what's up next. All right, so how much turnaround time will I have between assignments? So like I mentioned with the time off, I kind of might have got ahead of myself there, but turnaround time between assignments is entirely up to you. So what you can do if you want to have consistent work is you can plan your next assignment for as soon as your current assignment ends. So maybe you end, the second week of June and you start your next contract the third week of June. That's totally fine. The only thing you have to consider is just the logistics of getting to the new location depending on how far away it is. And if you want to go home in between assignments, that's something to think about as well. But if you're ready to go straight to the next assignment, that's great. If you want time off, that's great too. So like I said before, part of the advantage to being a traveler is making your own schedule. So good question. That's when we get a lot. So another one, how much am I expected to travel? Really the beauty of travel nursing is that all of this stuff is in your hands. The distance that you want to travel is up to you, and that's something that's going to be part of that initial conversation and really an ongoing conversation that you're going to have with your recruiter. So it's okay to change your mind about this over time. But the distance that you're looking to travel is totally up to you. You can let us know. Of course, you're going to have more options the further you're willing to go. That's a bigger radius for us to pull from. We can provide you with more options. Something else to consider with that is where you're licensed. So we can certainly assist you in getting licensed in a new location, and we can cover the cost of that license. But there is typically a time frame with the license. In some cases, it's a few days or a couple weeks. In other cases, it's a few months. So that's something to consider with traveling a further distance, is you might have to get a new license, and that might impact your time frame as well. So let's see. More questions that we've received in advance, but feel free to let me know, like Chris just said here in the chat. If you think of any other questions yourself, send them in the chat and I'll answer them, but we'll keep going with the ones that were pre-submitted. All right, so what if I don't see any jobs that fit my needs? Again, part of the advantage to working with multiple agencies is definitely that, you're going to get a lot of different options. So we might have something that you like while your other agency doesn't, or vice versa. So definitely talk to all your resources, but stay in touch with us. And we want to stay in touch with you too, because new jobs come out every single day. Typically, we have around 80 new positions in an average month. So it's something that you want to keep in communication about, because just because today doesn't have the job that you want doesn't mean we're not going to get it tomorrow. Something else that we do is called pre-marketing, and what pre-marketing means is proactively putting your resume in front of our existing clients. And what we would do is say, hey, we have an awesome clinician, an awesome nurse who is available at such and such a date, and if you're interested in potentially bringing this person on, we can set up a time for you to talk to them. So just proactively showing your profile to a client who maybe you'd be interested in the future. So we can talk about that too if you don't see any jobs that you like. Alrighty, another question here from Jamie. Jamie asked, can I work under more than one specialty? Definitely. We have a lot of nurses and clinicians, well really nurses, in our database who maybe have experience in something like both ER and ICU, or really anything along those lines. And we're happy to run jobs by you that are in multiple different specialties. So that is no problem at all, Jamie. All right, and I see Jess is logged on here. Hi, Jess. So Jess asked, what if I am not licensed in the location that I want to work in? Definitely not an issue. We're happy to get you a license in a new state. So that's something that is really great to do proactively. We will help you with the process and we'll also cover the cost of that license. So it's a big thing that you should talk to your recruiter about, because we can go ahead and buy that license and help run jobs by you as the time frame approaches that the license is coming in. I think I mentioned this before, but different states have different time frames for licenses. Some states have temporary licenses, which are faster to get than others. So that's something to keep in mind too. But if you're interested in going to a particular location, then let us know. We'll talk about the license, we'll give you the time frame, and we'll move it forward. Alrighty, so Jamie asked, how does housing work? Another good question that comes up quite a bit. Housing is typically dependent on what you're looking for. I would say the majority of our travelers like to stay in something like an extended stay or an Airbnb, something along those lines. What we'll do is we'll help you find options, and part of your pay package would be a stipend to cover the cost of that housing. So that pay package and that stipend, it's going to depend on the location and the facility and the compensation for that particular job. So that's something we will talk to you about on a case-by-case basis as we're going over the job options. But housing would typically be a stipend, and then we'll help you find the options that are worth looking into. Occasionally, there are facilities that have travel and housing built into their compensation budget. So they might have, an apartment down the street from the hospital where travelers are able to stay. Or they might make it part of the package, but the stipend would be the more typical way to go about it. So really good question there. I know a lot of people are curious about that. Let's see what else we've got here. All right, can I bring my pet? One of my favorites. I love learning about people's pets. I'm a big cat person personally, but I know a lot of people bring their dogs with them as well, which is fantastic. So lots of travelers bring their pets along with them on assignment. And personally, I think that's great to have your companion with you while you travel on the road. So we definitely can help you with the logistics of bringing your pet along. Our travel team can help find you, especially lodging. So lodging tends to be the biggest issue, and help you find something pet friendly so that your pet is safe while you're at work. But definitely you can bring your dog. I've seen people bring their cats and a few other different types of animals, so that's totally fine. Alrighty. See what other questions we have here. All right, can I bring my significant other? Yes, absolutely. Especially with COVID, I know a lot of nurses have told me that they have a significant other who's working from home, and that then affords them the opportunity to travel together because the significant other is able to work from home in the apartment or Airbnb or whatever they might rent, and that is completely fine. No issue there. So I think it's great, if you're able to go together. One other thing that we do frequently is we work with travel pairs, right? So sometimes we'll have a husband-wife or something along those lines where they're both nurses or they're both, in the healthcare field, and we make every effort to place them together at the same facility or in a similar location so that they can actually do travel work together, which is awesome. Alrighty. Good questions, guys. So I see I'm planning a vacation. Can we work around that? Yes. I would definitely not hold off on a travel position just because you're planning a vacation. We can allot time for that in your contract. So you would just, at the point when we're submitting you to a position, you would just let us know the dates of your vacation. what date are you flying out? We'll make sure you have that date off to the end date of your vacation. We'll let the facility know on the front end that you're not available to work on those days, but you're otherwise able to take that contract. And it's usually not an issue. I think I mentioned this before, but in most cases, our facilities really need the help of travelers. That's why they reach out to agencies like us. So they're appreciative that you're able to do the contract, and a week-long vacation or even 2-week-long vacation isn't really a big deal. So absolutely we can work around your vacation. So let's see what's next up here. Oh, how long are the assignments? Okay, so typically an assignment is going to be 13 weeks long. I would say that's the average length of a travel nursing contract. But that said, we definitely see shorter and longer contracts. So in some cases, they're as short as 4, 6, 8 weeks, something along those lines. That pops up relatively often. And sometimes we see 26-week long contracts or 6-month long contracts, which is great too. That works really well for some people. But I would say the majority are 13 weeks. With that in mind, though, even if the contract is ideally 13 weeks, that doesn't mean we can't present you for, a 10 or a 12-week contract or whatever time frame works better for you. Most of the time it is at least somewhat flexible, so I wouldn't necessarily rule out travel nursing just because you're not available for 13 weeks. If it's 10 weeks, that's fine. We can totally work with that. So definitely a good question there. I wanted to mention on that too, extensions. So extensions are a great option, and they pop up with, I would say, the majority of assignments, or maybe at least half of assignments, the opportunity to extend your assignment. So if you want to do something like 6 or 8 weeks to start, and then we extend you for another 6 or 8 weeks or another 13 weeks or whatever it might be, that's fine. And then the opposite of that, if you're like, oh my gosh, this assignment is really not for me, I want to move on, you do have the ability to give a 30-day notice, right, if it's not a great fit. So the length of the assignment is something that we can play with. So good question there. And then I see we have, can I choose where I stay? So yes, I think Jamie had mentioned earlier the housing, but I'll expand a little bit more on that. So yes, you can choose where you stay. We can help you find options, but ultimately where you stay is your decision, and you're going to get a housing stipend to cover the cost of it. So definitely a big question and a big concern that a lot of travelers have. Along those lines, it was just submitted, if I have an RV, do I need to stay in a hotel? Definitely not. You can use your RV. A lot of travelers do that, and travel around the country often with their significant other or with a friend, and they stay in campgrounds, and that can be really cost effective and really fun. So that is a great option, and if we're not helping you find an Airbnb or a hotel, then we can help you find a campground. That's not a problem at all. Okay, so do I get health insurance? So yes, we offer health insurance to our clinicians. We use Blue Cross Blue Shield as our provider, and it is offered to our travelers once they've been on assignment for 30 days. We have health and dental, and you can opt into that insurance for both yourself and you and your spouse or your family or whatever you need to do. Okay, where can I work as a travel nurse? So location-wise, you can work in all 50 states as a travel nurse, which is super exciting. I know a lot of people have on their bucket list certain locations. I hear Alaska a lot, and we do definitely have clients in Alaska that you could go to. So all 50 states, we have contracts across the country. I would say, rural locations are quite popular for travel nursing. Rural facilities tend to have a harder time finding nurses, permanent nurses, and allied health clinicians, just because there's not as many people in those locations. So they tend to have pretty frequent usage of travel nurses. So if you like, exploring nature, you like spots where you can go hiking, kayaking, skiing, whatever it might be, there's a lot of rural locations out there that would be interested in bringing you on as a travel nurse. But at the same time, it's, big cities, hospitals, big trauma facilities certainly aren't immune from being understaffed, so we work with a lot of those throughout the country as well. So if you're interested in, Chicago, New York, LA, we have contracts in those areas as well. So really, where can you work is where do you want to work? And that's something that your recruiter would love to talk to you about and tell you about the options that we have as they come out. So good question there. Let's see what's up next. So what nursing specialties does BHS work with? So BHS works with all nursing specialties, but we do see a lot of volume of requests in certain specialties. And they're probably what you would expect, right? We see a lot of requests for med-surg nurses, ER nurses, labor and delivery, OR, ICU, long-term care, psych. We've seen a lot of cath lab pop up. This is not in any particular order, just those are the specialties that our clients, I would say, have the most demand for. But we can work with all different types of nurses. So like I said, new jobs are coming out all the time, so if you don't see a lot of volume in your specialty, we're still interested in talking to you and telling you about what we have. And then we also work with allied health clinicians, so we work with a lot of respiratory therapists. We work with all types of imaging technicians, all modalities, and then we also work with pharmacists as well. So a pretty wide range, but that would cover the majority of what we've seen. Alrighty, can I go on assignment if I'm retired? So yes, you definitely can. A lot of nurses decide to retire from being a staff nurse or maybe in a nursing leadership position, but they want to keep working but maybe not work full time. If that's the case for you, travel nursing is definitely a great option. So if you're retired and you want to pick up an assignment, definitely talk to us. The only consideration is how recent your experience might be at a particular facility, or at a particular specialty, I should say. So sometimes if it has been, many years since the last time you worked in an ER, for example, a facility might be a little bit hesitant to bring you on. But typically if you, stay in nursing and you keep your skills up, there's no issue at all with working while you're retired. And then there are some other options too, like, more rural facilities might be willing, if they're a little bit slower, to move forward with somebody who doesn't have as much recent experience. Same goes for new grads. And then, primary care facilities or clinic settings tend to be happy to bring in retired nurses. So that can be a good option as well. But to answer the question, yes, you can definitely go on assignment if you're retired. Let's see what else we've got here. Okay, so can I work part-time? That is a question that pops up pretty often. So the thing to keep in mind with travel nursing is that typically nurses are going a distance, right? They're traveling across the country or they're traveling a few states away in order to take an assignment. And a lot of times it's not necessarily cost effective to do that for a part-time job. So it's something to keep in mind. But that said, once in a while we see things, really work out well where we have a nurse who's local to one of our clients who needs help, and in those situations we're happy to do a part-time arrangement, but definitely keep in mind that the majority of travel nursing positions are going to be full-time positions. 36 hours a week would be the most common, and 48 hours a week would be another option as well. So alrighty. What else we got here? These are good questions, guys. Okay, so how much prior experience do I need to work with BHS? So you don't necessarily need any experience to work with BHS. You can talk with us if you're a new grad. We're happy to answer any questions you might have as a new grad if you're considering travel nursing as a potential career path, and it is a great one. But definitely keep in mind that a lot of these facilities are bringing in travel nurses because they have, a critical staffing shortage. They might be really busy and really overwhelmed in some cases. So in those situations, they're going to be a little bit more hesitant to bring in a newer grad. But that said, it's pretty common for facilities to bring on, travel nurses with a year of experience, maybe even 6 months of experience. So we're happy to work with you and talk to you if you're a newer grad and, see what we might be able to do. We can look at rural facilities in those situations. And then, like I said, with the retirement question, we can look at primary care too. Alrighty, so why should I consider BHS over our competitors? That's a great question because there are definitely a lot of competitors out there in the travel nursing space as well as traveling allied health. So I would say some of the biggest reasons to work with us and to have us in your corner include the number of job opportunities that we have available. We have a large number of jobs open right now, and then, like I said, new jobs opening up literally every single day. So it's really exciting to see those new opportunities continue to come out. We also have some very consistent, good quality clients in good locations. So it's great to have clients who repeatedly are returning to us for more nurses, and clients that we really have a relationship with and who enjoy having our nurses there. It tends to result in a really good quality assignment if we have that relationship in place. We also do, like I mentioned before, but if you weren't on, the proactive licensing. So we will help you obtain and we will pay for a new license in a new state. That could also be a compact license if you live in a compact state. But we will assist you with that process, manage the process, and cover the cost of the license so you can go to that bucket list state that you want to go to. And then also consistent communication, right? So we're not the type of agency that's just going to put you on assignment and then forget about you. We're the type of agency that really wants to stay in touch and have an ongoing relationship. It's not a one and done type of thing. We want to, present you to a facility, get you working at one of our facilities, and then stay in touch so that we can either get your contract extended if you like it, or so that we can place you in a new location if you're looking to go somewhere else after the existing assignment. So it's something that we really want to have that rapport. Our clinicians are our biggest assets, so we really appreciate nurses and allied health clinicians that we work with, and I think that's probably the biggest reason that I would work with BHS. Okay, so can I work close to home? For that question, it really depends on what close to home means to you. So for some people that might mean a super local assignment, which can be difficult with travel nursing, but it does depend on what opportunities are available at the time. I know we just put a nurse to work who is working about 25 minutes away from his house, which is fantastic. So yes, it does happen. But close to home for other people might mean that it's just driving distance, right? So maybe they can drive, 3 hours away from their home and get a hotel and go home on the weekend. If you consider that to be close to home, then definitely that's a possibility, right? You don't necessarily have to get on a flight in order to take a travel assignment. So, that's something that a lot of people are concerned about. But yes, absolutely close to home. Let's talk about it. Let's talk about your radius, and that would be part of your initial conversation with your recruiter too. All right, so how does licensing work if the job is in another state? So we have a ton of information compiled on licensing, and your recruiter will be able to tell you the time frame and the requirements in order to get licensed in whatever state you're looking at. So like I said before, some states it's really fast, some states it takes a while, different requirements depending on the state, but we'll let you know what that looks like for the state you're looking to go to. We can do the application with you, we can cover the cost of it, and we'll see the whole process through. And then once that license is completed, or once we're close to getting that license completed, we can place you in a position in that state that you're looking to go to. So that's no issue at all. I wanted to mention too, compact licenses. So if you live in one of the nursing compact states, instead of obtaining just an individual state license, we can get you a compact license so that you can travel throughout all of those states, which is really awesome. I think there's 25 or 26 states right now in the nursing compact, but don't quote me on that. And then I wanted to mention too, temp licenses. So sometimes a state will have, a time frame of 2 to 3 months, but maybe the temp license only takes 2 weeks. Something like that could be an option too. So we're happy to explore all of those with you depending on where you want to go. Okay. So what happens if there's a travel-related issue? So this doesn't happen a lot, but it definitely does pop up here and there, right? So nobody can control the airlines, nobody can control the weather, so problems like that definitely pop up, and we are here for you if that happens. So if you run into something along those lines, you would just give us a call, including after hours. You can reach out to us. We have, a travel department within Barton that would assist you in figuring out what your plan B is, whether that's looking for, a different flight, or, finding a different rental car company, or whatever it might be. So we definitely will make ourselves available and will support you if a travel-related issue pops up. All right, so Michelle asked, how does credentialing work as a travel nurse? Good question. I know a lot of people are concerned about the credentialing process. It really is pretty straightforward, and we will assist you with that process. Again, much like the travel department, we have a credentialing department. So the credentialing department will assist you throughout the entire process, and it's going to be pretty similar to what you're used to with onboarding for a permanent job. It's going to be, filling out stuff like the I-9, completing a background check, doing a drug screen, titers, TB, all that kind of stuff. That really depends on what the particular facility requires. We're going to do what they need in order to get you onboarded. Some facilities require more, some facilities require less, but whatever it is, we'll let you know on the front end what you're going to need to do, and then our credentialing department will assist you with the paperwork. They'll assist you in setting up things like the drug screen, any medical screenings or vaccinations that you might need to get. We'll help you set up those appointments, so we're there to support you with the onboarding. You're not on your own on that. Okay, so what do I do if I decide I don't want to finish my assignment? So in the event that you don't want to finish your assignment, it's okay. I mean, not every assignment is the best fit, or sometimes, things change at home in your personal life, and that changes your plan. So in those situations, our nurses have the ability to give a 30-day notice to the facility if they need to end their contract early. We do the 30-day notice because that allows our facilities to have time to find somebody else to take your spot if you do need to leave a little bit early, but you have that in your back pocket if you need it. Alrighty, so who can I turn to for questions while I am on assignment? So that's going to be your recruiter. We're very relationship oriented at BHS, and I was mentioning that before, but we're not the set it and forget it type of agency, right? We really want to stay in touch with you because we want to make sure your assignment goes well, and we also want to, continue finding you new positions after you complete this contract. Let's find your next one. So we want to stay in touch with you throughout the assignment, and if you do have concerns, you would bring them to the attention of your recruiter. If we need to chat with the facility to resolve something, we're happy to do that on your behalf. So we are there for you throughout the assignment, through and through. Alrighty, what is up next? I believe we have a few more here. Right, so does BHS pay for travel accommodation? So I touched on this a little bit, but the way this works is in some cases the facility has a budget to separately pay for travel and lodging accommodations, but in most cases we do two things. We give you a stipend that is meant to cover your housing, meals, and incidentals throughout your assignment, and that would be weekly. And then we also cover the cost of relocation. So relocation would be up to $350 each way, and that is meant to cover either the flight to get out to the location or your mileage and the gas that you pay for in order to drive to the location. So we will reimburse for that for sure for all assignments, and you'll either get a stipend in the majority of situations, or occasionally you'll get housing paid for by the hospital that's hiring you. So good question there. And let's see what else. Who do I discuss rates with? Yes, so rates are definitely a big question that we get from our travel nurses and our allied clinicians that we work with. So I mentioned at the beginning, but when you first come on board with BHS, you'll send us over your resume, we'll talk about your experience, we'll do reference checks, and at that point that's a really good time to bring up your expectations for compensation. So if you need to make a certain amount in order to make things worth it for you, that's fine. That's a great time to bring it up. The recruiter also will be able to fill you in on, what does the client's budget look like for this particular position. The budget is going to vary depending on the facility itself. It's going to vary depending on the job, the location, all different factors. So the recruiter will be able to fill you in on that. And keep in mind, your expectations for what you need to make. So that would be part of, that initial conversation, and then it would be an ongoing conversation as we bring jobs to your attention. You can let us know, what the compensation needs to look like. So really good question there. So that was the last question that was pre-submitted to us. I really appreciate everyone who sent questions in and everyone who messaged questions in the chat here. But if anyone has any other questions, feel free to send it through now. Otherwise, we're happy to connect with you outside of the Facebook Live. You can send a message to us on Facebook or a comment. You can call us if you go to our website. You can email us. So feel free to reach out if there's anything that didn't get answered on here. But it was really great seeing all these questions and talking with you guys today. Alrighty. Thank you so much, everyone.